Well, I trust the people. I definitely trust you. So what is your opinion? Should we have masks every winter? At GB News on Twitter or gbviews at gbnews.tv. Let me know your thoughts. I'll air them shortly. But with me now to discuss this issue, our former NHS consultant, clinical psychologist, Dr Gary Sidley, who's the man behind the Smile Free campaign to end all mask mandates, and Dr David Strain, clinical academic and co-chair of the BMA Medical Academics Society, who represent all doctors working in academic medicine. Wonderful to have you both on the show. First of all, Dr Strain, what's your view about the idea of seasonal use of masks?
So seasonal view of masks will be very much dependent on what the viruses are at the time. If we have a year where the viruses are very, very mild, there's very little going on, then actually, and with the vast majority, leave it to the population, maybe in the public transports, maybe in the crowded areas. But similarly, if we face another pandemic, if COVID kicks off again and we end up in a position where the COVID is killing people, and not just those with the disease, but also the people who can't get into hospital because the wards are full of patients with COVID, then masks demonstrated to reduce the spread. And therefore, yes, it would be necessary to try and reduce the spread of COVID to keep society running normally.
David, where have masks been demonstrated to reduce spread?
So there have been several different cases where they've been demonstrated to reduce spread, and then simultaneously, when they were removed, to cause spread to go up. So the great example is in Brazil, where the vast majority of the population actually caught COVID. They had about 78% of the population had immunity. And then because of that, it was felt that they could go about life as normally, they could dispense with a mask, start having parties in the street. Within 2 months of them dispensing with the masks, the cases went up, and actually that's what gave us the P1, the gamma variant. So there has been very clear cases where masks were responsible for cases.
David, you're conflating human activity, close contact, people gathering in large groups with the lifting of the mask mandate. Why did cases fall in Florida and also in Texas when the mask mandates were lifted months ago? It was described at the time as Neanderthal thinking by Joe Biden.
So there are many different reasons that will keep infections low, and you will remember that when the mask mandate was lifted in Texas and Florida, it was actually the sunny seasons when people outdoors, they were mixing outdoors. Ultraviolet light is absolutely fabulous for killing this virus. What we're talking about here, though, is in winter, in crowded environments when we don't have good ventilation, that would be a time that masks would be worn. And in other cases, I mean, there has been cluster randomized controlled trials where some groups wore masks, other groups didn't wear masks, and actually the masks alone, that was the only intervention that reduced within household spread of the original SARS, so not COVID, the original SARS-CoV-1, that reduced that spread by about 63%. Now, again, that's one more example. And don't get me wrong, I am not saying masks for everyone, everywhere you go. But if we're in a setting where something like COVID is back and we cannot change our behavior, as an alternative to a lockdown, as an alternative to draconian measures, all wearing a mask to reduce the spread amongst the population to make sure we don't get to that level could be very worthwhile.
Dr Gary Sidley, wearing masks saves lives.
I think the evidence suggests otherwise. The evidence that masking healthy people reduces the spread of a virus, a respiratory virus, is at best weak and contradictory. And the more robust studies, particularly those in real life situations, suggest otherwise, says it does have no significant impact. But more importantly for me, I think, is that masking healthy people is not a benign intervention. It's associated with a wide range of physical, social, psychological, and I guess environmental consequences. So if it was benign and nothing to lose, and let's just be on the safe side, maybe one could go with that idea of masking up when viral prevalence was high. But no, it's ineffective. The evidence really isn't there to support it. To support mandates, the evidential bar would need to be very high indeed. And even many of the pro-mask people that I speak to admit that the evidence is relatively weak. So mandates definitely out. I think the evidence is weak and contradictory. And as I said, it's not a benign intervention. There are a lot of important negative consequences of masking healthy people for any length of time.
David, I like measures that demonstrably work, which is why I'm pro-vaccine. I believe it must be personal choice as to whether you have the jab or not, but it has been decisive, I think, in reducing hospitalisations and deaths. The issue with the masks is that the evidence is equivocal and therefore it must be personal choice. Do you take that view that if there are future measures in terms of people wearing masks, that it's voluntary?
We need to do things on the basis of people's best interest.
I'll take that as a no, then.
Gary. No, we need to do things. I agree with Gary that in some situations that wearing a mask for healthy individuals actually does do harm. I can't argue with that. There are other situations where masks have been demonstrated very, very clearly to save lives. And it needs to be taken in context.
That's a hell of a statement, David. I'm sorry, we cannot have glib remarks like that. I have to be so careful in my job to make sure that whatever I say is factually accurate. And the problem with masks is that they are equivocal. It's not definitive. And we were told by government advisors early in the pandemic that we shouldn't wear masks if we're healthy because they're counterproductive. In particular, Jenny Harries.
So when you talk about wearing masks when you're healthy, if you are healthy, actually you're right. The point of a mask is to stop the spread from you to other people. The bottom of a mask is to stop the droplets that you've got on you getting into the vulnerable elderly adults.
Does it concern you, David, that the virus is smaller than the holes in a mask by an infinitesimal amount?
I wouldn't say infinitesimal, but it's the
tens of
droplets
thousands
that they're on. I'll go with that. It's the droplets that they're in that cause the problem. And if those droplets are caught within the mask doesn't leave. I mean, you're absolutely right. You'd need an FFP3 mask, such as the ones that are saving the consultants' lives, such as saving people like me when I'm working on a COVID ward. And pre those FFP3 masks, we saw lots of doctors dying. Post us getting them all as a routine, we're not seeing as many doctors dying. And it's the same. The droplets that are leaving people's mouths are where the issue is.
And
so
if they've been so effective, Dr. Strain, why have we had such a high COVID death toll in this country? Why, for example, does Sweden, who never had a mask mandate, have a lower per capita death rate than the UK and than other countries that had strict mask mandates? At one point, Peru was the country that had seen the greatest number of COVID deaths, and they were arresting people in the street for not wearing a mask.
It depends when the masks are instigated. If you look at the countries that instigated masks immediately, actually, you didn't have those cases. So if you take Australia, for example, where it was the guidance, and I stress guidance, but the majority of the Australian people fed in. And even today, the mortality in Australia is much, much lower than here. They haven't seen the same economic crash that we've had. We've seen a 9.4% economic crash. They saw a 1.2. They're already bounced back.
Australia's not comparable. They're going for a zero COVID policy. It's an island nation that can exclude itself from the rest of the world. Britain is a global nation that cannot, David. We would suffer economic and societal damage that would probably be irreversible. Can I ask you, Gary, your concluding thoughts on this?
Yes. At the moment, the United Kingdom would appear to be the most frightened country, arguably, in the world. You know, we've got, despite the fact that all our vulnerable adults have been offered vaccines, despite the fact that I believe 93% of the adults carry antibodies, we're still frightened. And masks are really potent at maintaining fear. You know, recent opinion polls found that 60% of the population were frightened of lifting the final constraints on our behaviour. 20% of people apparently suffer with COVID-19 anxiety syndrome, this thing that Dr. Spada, the professor of psychology in London, has measured and validated. Now, it's a distressing combination of elevated fear and unhelpful coping strategies. And we know that fear kills. You know, fear has contributed, without doubt, significantly to the tens of thousands of non-COVID excess deaths that we've seen throughout the pandemic. And masks are a really potent way of maintaining that fear. One is obvious, that it's a blatant symbol that something is dangerous nearby. It screams that one of us is a biohazard, one or both of us. On a more subtle level, as I think I mentioned before, masks act as safety behaviours. You know, if you go back into society and mix with your mankind and womankind with a mask on for 2 or 3 weeks and have an uneventful and enjoyable time, when you finish that interaction after 2 or 3 weeks, your anxiety level will be no better, because what you'll do is the safety behaviour, the mask, will attribute your survival to the mask. Your survival will be attributed to the mask, and you will not draw the conclusion that the world is now safe enough to interact with. So,
David,
like I said
thank you,
before,
Gary. David, does it not sort of surprise you that with the mask mandate that we certainly had, that was enshrined in law, now it's advisory and it's being enforced by businesses and local authorities, that there are some mask products that actually say that this doesn't stop COVID-19 on the box? Does it not bother you that you are fulfilling your obligations to wear a face covering, even if it's just a scarf? Does that not make a mockery of it? And I'll quote you, a particular former SAGE advisor, Dr Colin Axon, who told Dan Wootton on this very programme that the best thing you can say about any mask is that any positive effect they do have is too small to be measured.
That is one opinion based on thing, and I would absolutely agree with those statements on those boxes. Those boxes are not designed to stop you, the wearer, catching COVID-19. Those masks are designed to stop you, the wearer, who are potentially an uninfected, an asymptomatic spreader, from spreading it. And so they're right, it doesn't stop you catching it, it stops other people catching it from you. To come back to Gary's analogy, when seatbelts were brought into legal mandate, and there was lots of people saying that, well, this is just going to drive fear of driving, it's just going to make people more hazardous. Actually, the seatbelts reduced accidents as well as reducing your mortality if you had an accident, because the seatbelt was that reminder. As Gary says, this virus spreads from person to person. And
but Gary, are seatbelts and masks comparable?
I don't think so. In most respects, no, because one of the things is that seatbelts, there's strong, robust evidence that they actually do save lives, and that isn't the case for masks. That's the case. And also, of course, seatbelts do not have a raft of negative consequences associated with wearing them. There's no negative effects, or maybe a slight discomfort, but there's no negative effects in the long run to wearing seatbelts. Whereas with masks, there's a whole raft of them, and I think that's the big key difference.
Final thought, David, what about the potential downsides of face coverings, such as a restriction on respiration, you know, the immune system? I wonder whether the harms of masks, especially on children in the classroom, have not been quantified. Also, the environmental impact. The Keep Britain Tidy campaign told me that we throw away 52 million of those disposable plastic masks every day. They're not recyclable. And earlier this week, one of my colleagues here on GB News actually talked about the issue of crime around face coverings. It's impossible now for police to find criminals because half their faces are covered. Is that a price worth paying?
So of those elements that you have raised, actually, I think undoubtedly the most pertinent is the environmental impact of this. These fluid-resistant masks, as we see them at the moment, I would agree entirely. There needs to be change. There needs to be some route to make sure that we can keep our vulnerable elderly, because remember, you wearing a mask isn't about you, it's about allowing our vulnerable elderly, the ones who the 95% efficacy of a vaccine isn't quite enough to keep them safe, is to allow them to communicate and to join in society. I would entirely agree that something will need to change with masks if we are to continue using them. The environmental impact is unacceptable. It does need to be fixed. And I'm sure the brains of the UK and the rest of the world can come up with some halfway house that does allow keeping our vulnerable elderly safe, despite the brilliant efficacy of the vaccine, that extra 5%, without doing the harm. And I do agree with you entirely that that is unacceptable, the damage that we could be doing, well, that we are doing to the environment in doing this at the moment.
And we can certainly all agree, David, that keeping the vulnerable safe is a total priority. The question is how we achieve that. David, while I've got you, can I get your views on COVID vaccine passports. Do you think that they are a necessary evil with which to prevent future lockdowns?
No. That was an easy answer. The only time the COVID vaccine passport has been assessed is that study in Netherlands where they put 650 nightclubbers into a nightclub with the equivalent of the COVID passport. They all had to be double vaccinated or had to demonstrate proof of a lateral flow test that demonstrated negativity within 24 hours of going there. Of the 650 clubbers, 27% of them had COVID within a week. That all came from 2 strains from that nightclub. COVID passports aren't the route. It's vaccinating just about, well, as many as possible to generate true herd immunity. Get rid of the virus. Let's get on with our lives.
Gentlemen, an absolutely brilliant debate. I'm eternally grateful to both of you for participating. Dr Gary Sidley, former NHS consultant clinical psychologist, and Dr David Strain, senior clinical lecturer from the University of Exeter. What do you think? At GB News on Twitter. GB Views at GBNews.tv. I want to get your opinions out there very, very shortly. Coming up, there's still time for you to get your questions in. I'll be speaking to Jennifer Arcuri, entrepreneur, crypto expert, economic expert, and of course somebody that knows Boris Johnson very well. She'll be live from Florida at 10 o'clock. So lots more to get through. A big 2 hours and 15 minutes to come. Don't go anywhere.